Welcome back to Twin Cities Live. So March is not only Women's History Month, there's St. Patrick's Day in here, and it's also Colorectal Cancer Awareness Month. Maybe not the sexiest, but you got to talk about it.
It is important to talk about. Get this, it's the third leading cause of cancer death for both men and women. So joining us from Entira Family Clinics is Dr. Thomas Haroldson. So welcome into the show. That is a shocking stat.
Yes, it is. Well,
So what is it exactly? What can you tell us about this type of cancer? Then who does it affect the most?
Sure. So, I mean, colorectal cancer is it's a growth. So cancer is a part of cell that starts to grow unchecked by your own body's kind of checks and balances system. And thus, it just keeps replicating, gets bigger and bigger, and then can spread because it doesn't have any of those checks and balances in our body. So who does it hit? Hits everybody, right? Or there's a chance of it hitting everybody, of course. So.
But most frequently, you say diagnosed among people who are 65 to 74 years old. Does it progress because people are kind of embarrassed to talk about it? I mean, it is one of those things where you're like, what's going on down there?
Well, I mean, that's one of our thoughts because colorectal cancer is also one of the most preventable cancers we have because of our screening tests.
Oh my gosh.
So the fact of the matter, being the third leading cause of death, we also want to still be able to keep those numbers down by using our screening tests that we have available.
Okay, who should be screened then?
Yeah.
Well, as you said,
age?
At what age?
Yeah.
As you said, 65 to 75 is the most common ages that get diagnosed with cancer.
Okay.
Now, the fact of the matter is, though, we're seeing cancers happening in younger and younger people. Over the last 20 years, it's been a 15% increase of those over the age of 40 getting cancer now.
Wow.
And so we recommend starting at age 45 instead of starting at age 50 to get your colorectal cancer screening.
Okay, so when you say screening, you're talking about a colonoscopy.
Correct. That's the most common.
That's
now,
the
there
most
are
common.
other ones.
There
And the
are.
reason why the colonoscopy is what we think about is because it's the gold standard. It helps both diagnose precancerous lesions, but also helps treat them. It's the only one that has that claim of treating them by, hey, if you find something growing in there, you cut it out and it's gone.
Wow.
Right? So that's why colonoscopy is the gold standard still.
Okay, what about an earlier screening? Because like my grandfather died at 49 of colon cancer, and so I remember my mom kind of like battling the insurance company to get a screening
An earlier one. Yep.
because they would only, pay for it when they were
Absolutely. 50 back then, now 45.
Right.
So the concept is, or the idea is, polyps take about 10 years to turn from a polyp to a cancerous cell. So the general recommendation is you take that youngest first-degree relative who had colon cancer, you subtract 10 years, and that's the age that you start. So using your example would have been, your mother's example, starting at age 39.
Wow.
Because her father had it at 49, subtract 10 years.
Interesting.
Oh, that is fascinating. So I know that the screening seems, now that I'm getting up there in age, I'm finding more and more people that are talking about getting the colonoscopy and all this stuff, and they always come back and say, you know what, it actually wasn't as bad as I thought it was going to be.
Kind of clears out the old system.
Yeah, it's a nice little cleanse. But like, what can you tell us and tell our audience, like, that it's maybe not as intimidating as it used to be, and are there other advancements to make it a little easier to handle?
I mean, the worst thing you'll hear is the prep. So it's not so much the colonoscopy that's the problem, it's the day before, right? It's that process.
You have to drink all that stuff?
You got to drink all that stuff. You have to cleanse it out. The joke that I have is always the first person that figures out a nice, gentle way to fully cleanse your bowel will make lots and lots of money. No, but that's the worst part, is just the day before. The day of the procedure, oftentimes they give you mild sedation, so you really don't remember it at all. Oftentimes I hear the joke that it was the best nap that they ever had, and you're fine moving along with your day thereafter.
But then it's not like something you have to get every year. Then it's 10 years?
If you have a normal colonoscopy.
Okay.
If you have a polyp, it depends on the polyp or the number of polyps if you have to do it sooner than 10 years. So there's little nuances there. But a normal colonoscopy, you only have to repeat every 10 years.
Well, there you go.
Well, so that's not so bad. I mean, it's 24 hours of a little inconvenience. You get a nice little nap, and if you're all clean, you don't have to do it again for
and
another
then
10
maybe
years.
your skirts fit a little better the day after.
But for those that don't want to necessarily go through that prep work, if you will, or the colonoscopy, we have stool tests as well. So their advantages is that they are non-invasive. They're in the comfort of your own home. They're essentially poop tests, if you will. Their disadvantages, though, one is that you don't get as long of a clearance from that because they don't directly visualize your colon, and they also don't treat it. As I said, a colonoscopy, you can actually cut out a polyp. Well, with a poop test, you're not. You're just looking for signs that you might be growing something in there as
And
well.
is that the same? Is that the FIT test that we listed up there?
Yep, so there's two of them that are the most common. FIT test, which just looks for biochemical markers for blood, and then there is a FIT test that also looks for DNA that combines together, which we commonly call Cologuard, which most people may or may not have heard of. And the Cologuard's benefit is that it actually looks for atypical cells or some precancerous cells in your stool. So if that's normal, then you get 3 years of clearance versus the FIT test is only 1 year of clearance.
Okay.
I got to be honest with you, Doc. I think I'd rather go through the 24 hours of drinking stuff and
just get
maybe
the
sitting on the
colonoscopy.
potty for a little than actually collecting my own. You know?
Yep.
I guess to each his own.
To each their own. That's
To each
what I
their
kind of
own.
say too, right? But I also, part of my conversation with people when I talk about these sorts of things is we live in America and we have medical care in America where costs do matter.
Yeah.
So we cover screening tests. So let's take the Cologuard test as an example. Your insurance will pay for the Cologuard, but if it's abnormal, you need a colonoscopy thereafter, and that colonoscopy is no longer a screening test because you have an abnormal
Now
test.
it's a treatment.
So now they might
Gotta
Exactly.
strategize.
So you do have to think about that. I don't think that's a reason why we need to make our decisions, but I think it's a component that some
Yeah.
people do take into
I
consideration.
agree. Dr. Haroldson, thank you
tips.
so much.
Thank you for all the insight. All right, if you want to learn more about Entire Family Clinics, call them at 651-788-4444 or visit entirafamilyclinics.com.